Hello and welcome back to our channel with a new video. Today we will discuss all you need to know about lower back pain. So without further ado, let's start with today's video. You're not alone if you've ever had low back discomfort preventing you from accomplishing what you want. Low back pain is one of the most common health issues worldwide. It affects more than 80% of adults at some point in their lives, making it a common reason for people to consult a doctor. What is the low back in the first place? As the name implies, it is pain or discomfort in the lower region of your back. This is the area that runs from the top of the buttocks to the waistline. How long does low back pain usually last? Fortunately, approximately 90% of patients presenting with low back pain recovers within the first year. The majority recover well and are able to resume work and activities within the first month. Yet the recovery depends on several factors as the cause of the pain, the patient's age and weight, the associated medical conditions, the treatment course followed, etc. Causes of low back pain. There could be no certain cause for low back pain, yet some conditions might be associated with increased risk as frequent trunk movements as twisting forward or side bending, reaching too far or long periods of sitting. Sedentary jobs. Physically demanding jobs. Whole body vibration exposure. Smoking cigarettes. Obesity. Educational status, psychological factors, and job satisfaction can also predispose to low back pain. Age is also a common factor with the highest percentage in the third decade of life. Also, there is a slight predominance in males due to occupational factors. When should I be concerned about my back discomfort and seek immediate medical attention? As previously stated, the majority of causes of low back pain are extremely benign and do not necessitate further testing, such as an X-ray. You can, however, seek counsel from your family physician. If you have any of the following symptoms, you should consult a doctor right away. Infection. If you have a fever, chills, or a history of IV drug use, you should be concerned about infection. If there is a history of malignancy, unintended weight loss, poor appetite, etc., a tumor should be ruled out. Trauma. This can result in fractures and should be looked at. Cauda equina is a condition in which the nerve roots in the low back become compressed. However, there will always be radiating discomfort down the thighs and legs, urine retention, bowel accidents with loose stool, and diminished sensation in the perineal area as a result of this. This is an emergency that usually necessitates immediate surgical intervention. Our advice is to go to the local emergency room if you experience any of the above symptoms. Otherwise, contact your doctor's office to schedule an appointment. Types of low back pain. Back pain can be categorized into two broad categories, which are axial or peripheral. Axial pain is when the pain is localized to the low back only. The axial pain could be due to low back muscle sprain, which usually responds to rest and some over-the-counter pain medications, or could be originating from the axial skeleton as bony vertebrae, intervertebral disc, or the sacroiliac joint. Peripheral pain is when the symptoms extend beyond the low back to involve the lower limbs as well. This radiation can take several forms as radicular pain, which radiates to one leg and follows certain nerve root distribution. Referred pain, which refers to the buttocks, posterior thighs, or inguinal region. Neurogenic claudication. This indicates presence of spinal stenosis, and usually there is pain in the buttock and legs. It gets worse with prolonged standing. Myelopathy, which presents as pain and weakness in the lower limbs, and usually due to motor nerve roots compression. Cauda equina syndrome. That's an emergency, which can present with bilateral leg pain, weakness, anesthesia in the perineal area, bladder, and/or bladder symptoms. Is sciatica a low back pain? No, it is a different problem, yet it is common. Sciatica is a painful condition that affects the sciatic nerve, which originates from the nerve roots in the low back. Sciatica is compression of the sciatic nerve just below the pelvic bones, so it is not originating from the spine. whereas radicular pain originates higher in the spine and radiates to the lower limbs. Low back pain diagnoses. Your doctor will need detailed description of your back discomfort in order to properly diagnose your condition. It's a good idea to keep track of when and where your back pain started, what activities you undertake, any associated symptoms, and any chronic medical conditions you have. Tests for diagnosing back pain. Usually no investigations are required as far as there is none of the previously mentioned alarming symptoms. In general, these are the lists of images most doctors might order. X-ray, tomography with a computer (CT), myelograms, discography, magnetic resonance imaging (MRI), electrodiagnostic studies. What would be the best way to deal with my back pain? The first step is seeing your doctor, who will obtain a good history from and perform a comprehensive physical examination. The red flag symptoms and signs should be explored both on history and examination. Afterwards, appropriate images might or might not be arranged based on each case. To make it simple, if we exclude the emergency conditions, the fractures and tumors most back pain would respond to. Over-the-counter medications. Patient education is imperative as some people are at risk of developing future back pain episodes. Local modalities as heat or cold. Weight loss. Decreasing or quitting smoking. Activity modifications and lifestyle changes to more comfortable posture, especially during work. Sometimes nerve pain medications can help with radicular symptoms that radiate down the legs. Your doctor can discuss this with you. Eventually, surgery might be an option if all the above failed in certain pathologies, as in cases of herniated disc, nerve root impingement, spinal stenosis. What is chronic back pain, and how is it treated? More than 90% of low back pain resolves. Yet, after excluding the pathologic causes, a small percentage of patients will continue to have low back pain for more than 6 months. By then, we call it chronic as it persisted beyond 6 months. The chances of diagnosing a certain cause in such cases are extremely limited, and the goal of treatment is to be more supportive to minimize the pain rather than cure it. In summary, low back pain is extremely common, yet more than 90% completely resolves within 1 year of its onset, and most patients will resume regular activities within 1 month. There are alarming signs and symptoms of more serious causes of back pain, and these should be approached on a case-by-case basis. Still need more information on this topic? Don't worry. We have got you covered. Check out the links in the description box below to learn more about our resources and other helpful materials. Before you go anywhere, make sure to give our video a thumbs up and also subscribe to our channel and click on the bell symbol so you don't miss any of our intriguing videos. Stay tuned until next week.